Climate has become a global challenge affecting countries in different ways with varying negative impacts ranging from hunger, disease and displacement of people. In this regard, Uganda is a signatory to different international instruments geared at addressing the impacts change and adaptation. It is against this backdrop that the Ministry of Health has launched the Climate Change and Health National Adaptation Plan to run from 2025 to 2030. The third Deputy Prime Minister Lukia Nakadama launched the plan in Kampala on the theme Building a Climate-Resilient Health System from Evidence to Collaborative Action.
Climate change today poses a severe threat not just to the environment but also to our health systems. It is the single biggest health threat facing humanity and contributing to environmental risks which are killing millions of people per year globally. We still have it here at our noses because Chitezi is still very fresh in our minds.
The Climate Change and Health National Adaptation Plan, that is to run from 2025 to 2030, has been supported by Rockefeller Foundation and other health development partners to guide the implementations of interventions directed towards health impacts of climate change.
Leadership at the Makerere School of Public Health has said that's an area they are thinking about and they want to develop programs around going forward. And I do hope that they do that. When I come back with them, I promise to visit again next year. Hopefully they will have developed those programs and we can talk more about how we support them.
We are going to look at chemicals, contaminations with food and many things. We need a good lab to be able to detect that because we can't see the pollutants with our naked eye. So we need a good laboratory to be able to do that. And that's really critical for us to be able to monitor exposures and disease patterns in our country so that we can have interventions. So that lab is really important for us.
The Ministry of Health described the Climate Change and Health National Adaptation Plan as an important milestone that will help Uganda to work with the global community to address climate change impacts.
This HNAP will only succeed if other sector plans are interlinked, are connected to this HNAP. We cannot implement as health alone. We need everybody. All government agencies.
Uganda is the first country in Africa and second globally to develop the Climate Change and Health National Adaptation Plan. Sudat Kaye and Adia Nakuti, UBC.